For the nearly 1 million people in the United States living with Parkinson's disease, dopamine replacement medications can offer valuable relief from symptoms. However, extended use can come with a series of challenges. Today, we're going to take an in-depth look at the disease, and we'll meet an inspirational woman who comes out swinging at Parkinson's. I'm Beth Troutman. Access Health starts right now. Parkinson's is a progressive neurologic disease that affects the ability to control movement. In persons with Parkinson's, specific areas of the brain undergo a rapid cell death, leading to the depletion of an important chemical messenger called dopamine.
Parkinson's disease as a condition represents the brain not having something it needs. The neurotransmitter dopamine is not being produced to the levels that it should be, and when dopamine is low, symptoms come out. Parkinson's disease is a very patient-specific condition. They present differently, they have a different progression over time, and they have a different set of symptoms. The cardinal motor symptoms of Parkinson's disease, the things that people really think about when you think Parkinson's, involve bradykinesia, or a slowness of movement overall, tremor that happens in most people but not everybody, as well as rigidity, tightness of muscles, and walking and gait instability. Now those tend to be the symptoms people think about, but it's not the total list of symptoms. Because if you pick a system of the body and you imagine slowing it down, it can have a symptom that's related to Parkinson's.
According to the statistics, most people diagnosed with Parkinson's disease are age 60 years or older. However, an estimated 5 to 10% of people with the disease are diagnosed before the age of 50. Anna was diagnosed with Parkinson's disease at 38.
So I had this slight tremor in my left pinky that directed me to go to my doctor, and before I knew it, like 3 months later, I was diagnosed with Parkinson's, and I just didn't even know what to think. I mean, I was blown away.
We were both shaken by the diagnosis, certainly not understanding a lot about the disease. I distinctly remember, just laying in bed at night, she'd be asleep and me staring at the ceiling, and it was a huge period of uncertainty.
I tend to not dwell on the negative. I'm a very positive person. So I allowed myself that day or so of being, sad and mourning what I had just heard. I got treated medically for it right away, but I didn't want to deal with it. I didn't want to talk about it. I didn't tell anyone. At my job, I was the youngest and only female on my leadership team. And I did not want to have another box put around me that might, limit my ability to achieve based on my actual abilities, not my disability. So I kept it quiet for a long time, and when you keep it quiet at work, it requires you to keep it quiet out of work. When you start that isolation of not telling and having that secret, it's very hard to break, because there's never a good time to tell people about it. So I think those of us, especially those of us that don't want to be pitied or provided sympathy, we tend to hide it. And I hid it for probably 10 years.
Coming up, how Anna is fighting her Parkinson's disease symptoms. Enormous progress has been made in the treatment and understanding of Parkinson's disease over the last 50 years, providing physicians with a vast array of therapeutic options to address the unpredictability of the disease.
Thanks for coming over. Would you like a piece?
Absolutely. You can never turn down cake, right?
Awesome. No, never.
So what are you up to now? Are you still working?
Well, I did work for full-time for 10 years post-diagnosis.
10 years is a long time, so you must have been managing your symptoms with medication?
Yes. In the beginning, it was pretty easy. The first 5 years in, I was managing my symptoms extremely well. For me, I knew it was time to start making a transition into retiring from that world, when my symptoms started impacting my ability to support my team. Being frozen in place outside an elevator while the rest of your team is inside waiting for you to enter is quite frightening and stressful, as you might imagine. So I knew it was time to make a change.
That had to be incredibly difficult. So what do you do with all of that energy, all of the things that you loved about your job? Where do you put all of that mental energy and all of that passion?
It's a great question because, I think that with Parkinson's, one of the major points of success is that you have to continue to have a purpose. And my purpose was gone. Those of us that have young onset, it's very different for us. Mm-hmm. We're not retired. We're in the crux of our careers, we're having kids, and it's really hard. I decided to start the Young Onset Parkinson's Network, and we're now in 48 states and 17 international countries, which is unbelievable in a very short period of time, but it goes to show you the need that was there for coming together of people of like age and issues, and we have a lot more to do, so it's been very exciting and fulfilling.
Dopamine-replacing therapy such as levodopa continues to remain the gold standard and the most effective medication for the treatment of Parkinson's disease symptoms. Dr. Falconer explains.
The vast majority of patients, if not everyone with Parkinson's, will be treated or are currently treated with carbidopa-levodopa. It's an incredibly effective medication. And so our goal of care is to give people dopamine back in a smooth, consistent, and predictable way. So early on in Parkinson's disease, most patients can take carbidopa-levodopa and feel really good. They can take it 3 times a day, and for a lot of patients, their symptoms are controlled. And usually after about 4 to 6 years, patients start to fluctuate. They start to feel the medicine when it kicks in, they feel it wearing off, they have their symptoms return, they take another pill, they feel it kick in, they feel it wearing off. And it's those fluctuations, that inconsistency of response, that really holds our patients back from doing what they want to do during the day and living their best lives.
So this has been a long time for you. How are things changing? How have they changed?
I fared really well for at least the first 10 years or so with the medications working and being very effective. But after that point, many of us start to experience what we call off episodes.
What are off episodes?
So it's where your medication stops working as well as it did before. It's kind of like feeling like I'm stuck in the mud. I can't move, I freeze. And I have a hard time starting to walk. And then when I do walk, I'm very small-stepped and shuffling and very uncoordinated and look very awkward and feel very awkward.
When this started happening, did you have to have conversations with your doctor? Did you have to change medication, timing of medications?
A little bit, yeah. I mean, that's a very important point you brought up, is your relationship with your doctor. It's so important to have a good one and to really find someone that can partner with you. And I did. I talked with my doctor quite a bit.
So it's very personal.
It is, and it's very unpredictable, which is the worst part.
Did that unpredictability of it, has that impacted you being a mom, just your day-to-day?
Yeah, sure. I mean, my girls now are grown, 23 and 21, so less so now, but certainly as they grew up through their middle school and high school years, you can't decide when you're going to go off. And also stress exacerbates the symptoms, so trying to get to a game on time, whether it's basketball or swimming, it was really hard.
I've read that exercise can really make a difference in your life. Talk to me about what exercise means to you.
Without exercise, I wouldn't be doing nearly as well as I am today.
Wow.
And, it has to be consistent, 5 to 6 times a week of high intensity, not just like walking around the block. But the important thing is do something you like, because then you'll continue doing it.
What do you like?
My favorite thing is boxing.
Okay.
Yeah, I really have a passion for that now. I think it's the combination of the high intensity workout and the ability to punch something when I'm really frustrated.
Sure. I happen to love boxing too.
You do?
Yes, I do.
Wow. Great.
So you have a trainer that you work with?
I do, yeah. In fact, I'd like to introduce you to him.
Okay, all about that. Coming up, Anna shows me the ropes. For people with Parkinson's disease, exercise can be not only healthy, but a vital component to maintaining balance, mobility, and daily living activities. Studies are also showing that PD patients who exercise may experience benefits. For Anna, boxing has been a lifeline.
I do.
That's
I love
incredible.
It. It's really a good workout.
What's up? How's it going?
Good to see you. This is Beth.
Beth, very nice to meet you.
This is Alex.
So nice
Awesome.
to meet you. I'm super excited to
Okay.
box.
All right, you ready to go?
Let's do it.
All right, first we get some high knees going. Rocksteady Boxing is a boxing program for people with Parkinson's. It's international, so there's a bunch in the United States, but it's reached as far as Tokyo, Norway. I mean, there's all across the world there's Rocksteady Boxing. A typical boxer's program, they focus on a bunch of things: balance, footwork, hand-eye coordination, reaction time. So we're gonna switch the butt kicks right here, switch the butt kicks. Bringing all of these different factors into one single workout, which is what really makes it super, super effective against Parkinson's.
So the first part we're doing right now, obviously warming up and stretching.
Warming up, yep.
Stretching has to be so important
Absolutely.
for this, right?
So, because stiffness is one of the huge symptoms of Parkinson's. So before every single class, you got to do a little warm up just to get the blood flowing, the joints nice and loose as well. So we always do a typical stretch.
Nice.
That's a little bit of a.
That's the warm up?
Exactly. 1, 2, 3, 4.
Why is
Good.
this important
3,
for
4,
a
3,
patient
4.
like Anna?
Because this gives a lot of good visual cues for her. I can really pick on her form, so the weight transfers in her feet, the rotation in her core, and especially on like the 1-2, 1-2. I can focus on the extension of the arms on her 1-2 as well to fight that rigidity that she may have. So this is one of my favorite workouts to do because one of the symptoms of Parkinson's is a soft voice. So it really is hard for them to kind of yell and speak loud and clearly. Only one of you is going to be punching at a time. But
While
as she
I yell.
punches it, I want her to yell out the numbers. So count to 10.
Yep.
Here we go. Ready?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, go!
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
You get her a high five next after this. Step back. Ah, very nice. Good job.
Nice.
Very nice.
That was awesome. That was a really good
Yeah,
workout.
isn't it fun?
So much fun.
Yeah.
Have your off periods impacted your workouts?
I don't really let them so much, you know. I try to fight through them when I work out, but they have impacted my life for sure, especially, you know, time with my family. The first time, it was summer and the streets were really crowded, the sidewalks were really narrow, so I was walking in the front of the line, feeling good that day. I was loose, I felt great, I was moving well, and it hit me when one of my daughters behind me said, "Mom, why are you walking so weird?" She said, "Mom, stop that, you're embarrassing me." And so that was the first time that I really noticed the impact that symptoms can have on your family and your loved ones, as well as yourself.
Did you talk to your doctor about it?
I did, yeah, and he confirmed that that was dyskinesia that I was experiencing.
Dyskinesia can present in many different ways. You can have whole body movement, you can have writhing of the chest, of the arms, or it can be an even smaller thing like extra movement in the face, movement of the tongue, or even some twitching or pulling. Interestingly, most patients who experience dyskinesia actually don't realize they're doing it. Dyskinesia truly is a side effect of our therapies, and it's important for people to realize that dyskinesia represents the peak of how our medicines are working. It's an overstimulation of the system that results in that excessive movement.
Coming up, treatment options and management strategies to help with Parkinson's, dyskinesia, and off episodes. While Parkinson's can pose plenty of challenges for patients, not all of them come from the disease. As we've been discussing today, long-term use of levodopa is often complicated by motor fluctuations and dyskinesia.
The real challenge to treating Parkinson's over time is that every patient's journey with Parkinson's medication needs, symptoms, and progression are completely different. And so it reaches a point for a lot of patients where we're kind of chasing our tails a bit, because we have this fundamental medicine that lasts for 3 to 4 hours, and we're trying to fix that chemical problem all the time. And so we enter this phase of just ever escalating more pills more frequently, trying to fill that tank of dopamine in a better way. So if you have a patient who is fluctuating, periods of good, periods of bad, and our tool is part of the issue that's making them fluctuate, then we enter this real catch-22 of having patients take more medicine more frequently and watching this frequency burden and this pill burden of our treatments start to overtake every aspect of their functioning. I recommend GoCovery in my patients that have off episodes, dyskinesia, or both.
GoCovery amantadine extended-release capsules is indicated for the treatment of dyskinesia in patients with Parkinson's disease receiving levodopa-based therapy with or without concomitant dopaminergic medications as adjunctive treatment to levodopa-carbidopa in patients with Parkinson's disease experiencing off episodes. It is not known if GoCovery is safe and effective in children. How has GoCovery worked for you?
For me, it's worked really well. It was very easy to start on and add to my drug regimen because it's taken just once a day at night. I personally had no side effects, but everybody is different, and my doctor did monitor me quite a bit in the beginning. It has reduced my dyskinesia, and it has reduced my off time, and it has increased my good on time. So now I'm really able to travel again with my family with less concerns around dyskinesia and off periods affecting our trip.
Thank you so much for your willingness to share
absolutely.
your story.
Yeah, it was fun.
Been such a great day.
Absolutely, I agree.
I'm going in for a hug.
All right. Thanks so much.
Important safety information. Do not take GoCovery if you have severe kidney problems. What should I avoid while taking GoCovery? Do not stop or change the dose of GoCovery before talking with your doctor. Call your healthcare provider if you have symptoms of withdrawal such as fever, confusion, or severe muscle stiffness. Do not drink alcohol while taking GoCovery, as it can increase your chances of serious side effects. Do not drive, operate machinery, or do other dangerous activities until you know how GoCovery affects you. If you took too much GoCovery, call your doctor or go to the nearest hospital emergency room right away. What are the possible side effects of GoCovery? Falling asleep during normal activities. Activities may include driving, talking, or eating. You may fall asleep without being drowsy or warning. Suicidal thoughts or actions and depression. Tell your doctor if you have new or sudden changes in mood, behaviors, thoughts, or feelings, including thoughts about hurting yourself or ending your life. Hallucinations. GoCovery can cause or worsen hallucinations, seeing or hearing things that are not real, or psychotic behavior. Feeling dizzy, faint, or lightheaded, especially when you stand up, orthostatic hypotension. Lightheadedness or fainting may happen when getting up too quickly after long periods of time, when first starting GoCovery, or if your dose has been increased. Unusual urges. Examples include gambling, sexual urges, spending money, binge eating, and the inability to control them. The most common side effects of GoCovery include dry mouth, swelling of legs and feet, constipation, and falls. If you or your family notices that you are developing any new, unusual, or sudden changes in behavior or related symptoms, tell your healthcare provider right away. These are not all the possible side effects of GoCovery. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Tell your doctor about all medical conditions, including if you have kidney problems, have unexpected or unpredictable sleepiness, sleep disorders, or currently take medication to help you sleep or make you drowsy, are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. GoCovery may harm your unborn baby and can pass into your breast milk. Tell your doctor about all the medicines you take. Include prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your doctor if you take medicines like sodium bicarbonate or have had or are planning to have a live flu vaccination, nasal spray. You can receive the flu vaccination shot, but should not get a live flu vaccine while taking GoCovery. Please see full patient prescribing information at www.gocovery.com.
For more information about GoCovery, visit gocovery.com. And if you've missed any part of our discussion today, you can visit our website, accesshealth.tv.